healthy is vital at every age, and hip pain or discomfort can be one of the greatest physical struggles. Whether you're in middle school or if you're middle-aged or enjoying your later years in life, we all need to strive for great health. Joining me now is the medical director of the Pediatric and Adolescent Sports Medicine at Women and Children's Hospital, Dr. Peter Gambacorta. I'm so glad you're here. How are you?
Very well, thank you. Thank you for having me.
There's so much to talk about with hip pain, so let's get right to it. Hip pain, there's arthritic hip pain and then other kind of hip pain, isn't there?
Correct. There's two different types of hip pain. Actually, there's multiple levels of different hip pain. And the hip itself is actually a ball and socket joint inside the hip. Around the hip, we have 27 different muscles. We have tendons, we have ligaments, we have different cartilages. The cartilage surrounding the hip joint, we have a type of cartilage called articular cartilage, which is the shiny chicken bone cartilage that goes on the ball and goes on the cup.
Okay.
When that breaks down, that's arthritis. We have another cartilage inside of the hip that's called the labrum. And the labrum actually forms a suction seal around the hip. That can also be injured, and those are some things that can cause some pain inside of the hip.
Now, this is what I like that you're doing specifically here in Western New York, because I don't think anyone else is doing it in this area. You aren't going right for hip replacement. You're doing arthroscopic surgery that can really give people some extra time, and I love that because I like the minimally invasive.
Correct. Yeah, arthroscopic hip surgery is a minimally invasive approach to the hip. This is something where the technology has been around and just been catching up to what we can do inside of the hip for the past 5 to 10 years. Previously, people who presented with hip pain would have the choice of doing physical therapy, maybe taking some medicine by mouth and living with it until the hip pain became too severe and they needed a hip replacement.
Right.
Now, arthroscopic procedures for the hip, which is a minimally invasive approach, as we said, involves 2 or 3 small poke holes about the size of my pinky finger that you put around the hip joint.
Okay.
And we can go in the hip joint when we know what is injured. Some of those structures, which I alluded to earlier, might be injured, and those can be repaired or sometimes debrided as needed.
And how long is the recovery if you were to have the arthroscopic surgery?
Depends on multiple factors like how much pathology there is in the hip, what's being done, and age all play into the component. A typical recovery would be between 3 and 6 months recovering from the hip before you're going back into full sports and play. If you're younger and a younger adolescent, they might be closer to that 3-month mark.
Do you worry about diet playing a factor into our joints becoming a little bit weaker?
Sort of. So yeah, diet is related based on how much you're eating and leading to weight.
Okay.
So the heavier you are, the more strain you're putting on your joints, and we see that across all the joints, whether it be your hip or your knee or ankle.
What symptoms would somebody present to you that you'd be like, that's a hip issue? Great
question. So when it's your hip, I think if you ask people where is your hip, you get a lot of different answers.
Yeah, I would say right, the side,
like the side on their hip bone. Some people might point to the bone on the side of their hip. Some people might point to their groin. When you're actually experiencing pain inside of the joint, you're going to feel it in the groin. And people often use a C sign when they're describing, where they take their hand in the shape of a C, and they kind of say, it hurts here, and they use their hand to demonstrate where the pain is. That would be hip pain. Now, sometimes when you have pain on the side of the hip, that would be more of a tendon problem, or pain in the buttock might be coming from your back. So it's important to differentiate where this pain is, and then you can figure out how you can best treat your patients. And
so when we look at hip pain, are you seeing it in children more today than you did, say, 5 years ago?
Yeah, I think our antennas are up as far as making the diagnosis and being able to treat this now. The hip pain that we see in children and adolescents is typically going to be related to a sport or an activity that they're doing. It's going to be something where there's a lot of high hip flexion and rotation of the hip. And initially they might injure their hip and it's a groin sprain. Okay, so we see that a lot. But groin sprains get better.
Yep. And hip
usually
pain.
within a week or two, it'll get better. And if they go back to play and do their sport and that pain returns, then you have to think there might be something else going on here that needs to be looked into.
Thank you so much for stopping by today.
Thank you very much.
And just so I could say it, so if it's hip, he's the guy. Nice to have you here.
Thank you very much.
To learn more about the adult and the pediatric sports medicine program at Women and Children's Hospital, you can log on to their website at kaleidahealth.org or give them a call to set up a consultation, 878-7000. Women and Children's Hospital, located at 219 Bryant Street, right here in Buffalo, with cutting-edge technology and a group of renowned doctors. Don't wait any longer to give them a call. It's time to live without the hip pain and enjoy great health. Now, don't go anywhere. Coming up next, it's one of the best ways to get rid of unwanted hair. I'm talking about laser hair removal at Buffalo Laser Spa. They've got the newest machines and some great offers that I'll be sharing with you in just a minute. After that, how about checking out what's new at Kitchen World? We'll be in studio to share some great ideas and new designs that can live anyone's expectations. You're watching Western New York Living.
This segment of Western New York Living was paid for by Women and Children's Hospital of Buffalo.